Bismillah ar-Rahman ar-Rahim. I would like to present Professor Dr. Maisa Shawqi, Professor and Chairman of Public Health Department, School of Medicine, Cairo University, and she was the former Deputy of Minister of Health and Population and the founder of Clinical Nutrition Board in MOHP. Professor Maisa will present for us epidemiology of COVID-19 in Egypt. Please, Professor Maisa.
اولا بحب اشكر الاستاذ الدكتور جمال عصمت الدكتور احمد الكردي اليوشيد جروب for making me participate with you in this session. انا هحب النهارده ان انا اكلم حضراتكم على epidemiological aspect of COVID-19 and how this epidemiology is very important for shaping the future of healthcare in Egypt and all over the world. Every day we are following on numbers for the COVID pandemic, and it is rapidly spreading, it's rapidly increasing, and case fatality rates are also continuing to change. Bulk of research is identifying clinical characteristics every day with novelities. Recently, the clinical manifestations of COVID has added some gastrointestinal manifestations, and we are identifying pertinent diagnostic criteria, novel ones, providing effective treatment and care. And all of this is the yield of epidemiological research, which are vital for overcoming the pandemic. I'm going to review and reflect upon the COVID-19 latest formal report, and this was issued September the 30th, and illustrate the role of COVID epidemiology in shaping the future of healthcare. If we are to revise the definition for epidemiology, so epidemiology is the study of the distribution and the determinants of health-related states or events in specified populations and its application of this study to control health problems. Out of that, we reach the important and the final part of this statement. Why are we doing all this epidemiological studies and research and verifying its validity and doing some data analysis, statistical analysis, doing comparisons and reaching for recommendations? We are doing this to reach some form of improvement in the healthcare of our populations. The latest report is issued here in Egypt in a certain infograph. All Egyptians are accustomed by this colorful infograph that is in blue and red. And we are all the time reading how numbers are changing every day by the end of the day. Now we have 103,000 cases totally recorded in Egypt, and recovered are 96,494. This is around 93.5%, and the mortalities reached 5.7% with a total of 5,930. Today, we have under treatment or currently treated 774 patients all over Egypt, and in the intensive care units, we have 41. This is according to the formal report. This formal report might not be the accurate one to represent the situation all over Egypt, because there is a limitation to go further in analysis of these numbers that we do not have community screening program for COVID-19. If we are to think about why did we succeed in reaching a 93% cure rate, and why are the mortality rates reaching 5.7, is because we have certain factors that have maintained a successful management plan ongoing in the public and in the governmental and in the university hospitals everywhere. The number one is the presidential follow-up and support, the alert responsive ministerial board, with well-coordinated inter-ministerial complementary interventions, and this was really very beautifully managed. We have a national screening program for the non-communicable diseases and the hepatitis C virus, the 100 million health initiatives, and this screening with all its updates has managed to update the health map for Egypt. Within the COVID-19 pandemic, there has been good participation from the private sector and the NGOs, and there has been an encouragement and facilitation for the COVID-19 research in all higher education institutes, with the formation of COVID-19 research units in all universities. And in person, I'm proud of being there in the Higher Supreme Council for University Hospitals COVID Research Committee. We also had the utilization of smart communication through the mobile phones and WhatsApp programs. And this was the time when there has been a real rise or inauguration for telemedicine. And the population came to know that there could be a telemedicine utilization in the COVID-19. Amongst the important factors is that we have a unique healthcare system. I wouldn't say that it is very strong or it is very updated, but I can say it is very unique. Unique in what? Is that we have a well-distributed fever and central hospital in all rates all around Egypt. We have a fever hospital and a central hospital. We have a primary healthcare facility network all over Egypt that exceeds 5,000 units. And the higher education hospitals, 135 hospitals, have been also applying the state of the art in the diagnostics and in the management. And we have just listened to Professor Mustafa Shazli and how iconic our French hospital has been in managing cases in Cairo University. And what was also very important for this success story, as we have seen from the earlier two presentations, is that there has been a regular update for the clinical practice guidelines. A second feature for success was the WHO and the international organization with close monitoring and guidance, with epidemiological updates made every day, and sharing international successful interventions and research. And let us all remember that 2020 has started with all COVID research open access for all people all around the world. Private sector and NGOs also played an important role, and I think it's a magical role in our country, both at case management, diagnosis, and therapeutics, and in funding and in social support. The regular updates for the clinical practice guidelines have been done at the very early stage for the COVID case, and then it has been differentiated for COVID cases with comorbidities and along the different age groups and for pregnant women and physiological status. This issuing of the clinical practice guidelines had made it easy to standardize and properly use the available resources within the public and the private sector. Of course, we wouldn't miss the influence of having presidential selection of Professor Aoud Tegdeen and the Higher University Council for Hospitals with all its representations from the different hospitals. Professor Maher Rabat in the AMRO, Eastern Mediterranean Region Office for the World Health Organization. And we started to work together with the Ministry of Health, with the public and private sector, and to share the opinions and suggestions and the policy briefs for the research. And I would wait a little bit until we show the policy brief terminology later on. Guidance has been on wearing masks and helping people wear masks and making the masks available and at a very cheap price, and suggesting the cloth masks for the public also has been very important. Physical distancing and screening at important checkpoints has been also very valuable in terminating or in controlling the disease state. Now we come to an important question. How can we optimize these epidemiological studies and the recommendations? We have wealth of research, whether it is national or international. It is an open access research all over the world. And we have everyday search of research published on the internet. What should be done, or what can we do best to optimize this use? Let us think backwards. We witnessed the worldwide biggest social marketing ever to make the people aware about the virus, the COVID-19 virus, about how it spreads, about the risk factors, how people will protect themselves, and it has been so invasive and bombarding along the 24 hours, reaching people all through the TV, the radio, the newspapers, the billboards, the mobile alerts. And within the scientific committee, we had scientific webinars and online meetings. And social marketing itself has been so important and played a very important role. But we still need, through the epidemiological studies, to go for social marketing research. It is greatly needed. Why is it greatly needed? Because we need to know, what about compliance? People got to know right now that we need to flatten the curve. There is a curve and we need to flatten it. They got to know about social distancing or the physical distancing issues, but the compliance is not good. So what percentage of compliance did we reach? What is preventing people from following the instructions? And how can we deal with these challenges? This necessitates what we call the community research for the compliance. We need to think about targeted screening for higher risk groups. We cannot go for screening in our country. We cannot screen the whole community the way some developed countries are doing, and they are announcing every day the big numbers on their diagnosis. So we need to have a method for targeting the high risk groups with the screening test, with whether it is PCR or elsewise according to the availability, and then we can target them with health promotion and disease prevention strategies that are prioritizing those who are at risk. I'm putting here an example of research bringing about the risk. Maybe as doctors or clinicians, we understand about older age, about male gender, about people with non-communicable diseases like the diabetes, the hypertension, the obesity, and they are more at risk. But when we speak about the public risk, we are speaking about poor quality of air, about housing insecurities, about transportation insecurity, where a patient might need a transportation to the nearest facility and cannot go, and living in senior living communities, and these are the elderly institutes. What we really need is the policy brief units. What is the policy brief unit? A policy brief unit should be put in adjunction with the research committees in all universities and in all research institutes, where we analyze the big data and within the available budget for implementation of these recommendations with each policy that is implemented on a national scale, and it could be even implemented at a sub-national scale according to the availabilities of resources. We don't need to yield research and put this research on the internet with an open access, and we don't make it actionable. What we are thinking about is how to make the research, the valid research recommendations, actionable on a national scale and on a sub-national scale. COVID-19 home confinement negatively impacts social participation in life or in satisfaction. So there is a negative psychological impact of COVID-19, whether people have experienced the sickness itself, the disease, or are afraid and having anxiety out of it. And this necessitates a very big, or what we call a national scale research is greatly needed. Well, if we are going to nest the COVID-19 management crisis in a strategy for health, we are thinking, is this necessary? Do we have to think about this right now? What are the expectations for the COVID-19 situation? Is it going to continue with us for 1 year, 2 years, 3 years? Is a similar virus going to happen again with its thrombogenic abilities or not? This is how we think in the near future. How can we strategize for health and we integrate the COVID-19 management crisis within it? In Egypt, we are moving towards the universal health coverage, and this has been a decade or maybe 10 years of preparation with an intensification of the approach to reach universal health coverage in the past 3 years. On the way to universal health coverage in our country, we have been working on strengthening the institutions in 5 governorates and elsewhere, supporting the transformation towards the universal health coverage philosophy and framework. And this has helped us a lot during the COVID-19 pandemic in certain governorates, and is expected also to be of great benefit in the next coming future. When we think about the national health strategies, and this strategy or framework I'm sharing with you is applicable even on a healthcare organization. So we should start with population consultation, where research is going again to answer what would the people think about and what are their health priorities, what are their health problems, in order to make demand and the needs coincide. And then we conduct situation analysis and priority setting. When we finish the first phase of planning, we go for strategic planning and operational planning, making the operations or making the planning optimal in a decentralized fashion or at the end stage healthcare facility. We have another unit that's going to go for the costing and the budgeting and to tell us what to do and what can we do and what can we not do and the alternatives. And we have to undergo a very serious monitoring and evaluation for an early health plan to be conducted. Epidemiology of communicable and non-communicable diseases comes as a feed-in data that has to be renewed. In our country, we do have a surveillance system and we have ongoing research through different venues. So both of them constitute the backbone of the decision-making process. And then we put here the management plan at the lower left corner again, and we put a very big axis for epidemiological research and biostatistics. And as public health people, we consider very much the social determinants of health because they define how people are going to react and what percentage of them is going to get sick. The community nutrition and how can we deal with nutritional deficiency disorders and malnutrition problems because there is a very well-known science for interaction of infection and malnutrition. And we have to think big about the health education and social marketing. Or social marketing means making the people aware about their health and taking better decisions, better control on their lives in the everyday life. What we should be doing in the COVID pandemic right now is to add the COVID-19 surveillance to the healthcare force or to the healthcare framework for strategic planning. And within this, we think about the surveillance system for data collection. This is the research, and we can refer to research that's ongoing research or even the results of earlier research within the current past 3 years. We analyze the data and interpret it, and then we disseminate it. And this is very important because it directs all the decision makers all around the country in having better decisions, better command for their decisions, and taking public health actions on the national and subnational scale. Public health actions or interventions necessitate also monitoring and evaluation and feedback, and then we go again into the data collection if something is still unanswered. What about Egypt? Currently, a nationwide surveillance system is being designed to summate big data from different resources, whether the resources are the Ministry of Health or the university hospitals, military hospitals. All of them are being grouped right now. Work is being done to group all this surveillance system, especially so for the COVID-19 issue. And finally, I would say that the role of public health in COVID-19 crisis is to streamline, to integrate all evidence-based health interventions for prevention and control in the national health strategy. And this is what we call shaping the future of healthcare. شكرا لحضراتكم.
شكرا دكتوره ميسة على الاكسلنت برزنتيشن. دكتور محمد البدري.
شكرا يا فندم، شكرا لحضراتكم جميعا. معلش احنا بنعتذر بقى للجنه المنظمه ان احنا خدنا بعض الوقت شويه زياده عن الجلسه. متهيألي بقى مش هيبقى في وقت للدسكشن والاسئله، ان احنا تجاوزنا الوقت المسموح به بحوالي ربع ساعه. احنا بنشكر حضراتكم جزيلا، وإن شاء الله تكون جلسة مثمرة ونافعة للجميع. بنشكر اللجنة المنظمة ونلتقي إن شاء الله قريبا في جلسات تانية بإذن الله. شكرا جزيلا لحضراتكم.
شكرا.